Pathology of acute rheumatic fever. Acute rheumatic heart disease is a pancarditis that involves all three layers of the heart: endocardium, myocardium and pericardium. كلمة pan معناها كل جميع، فpancarditis معناها all three layers: endocardium the innermost layer lining of the heart, the myocardium the in between muscle, and the pericardium the outermost layer. Myocarditis يعني pathology of myocarditis بالcardiac muscle middle layer. Characteristically, there is an Ashoff body. Ashoff body is a characteristic granulomatous lesion of the rheumatic myocarditis developing several weeks after symptoms began. This structure initially consists of a perivascular focus of swollen eosinophilic collagen surrounded by lymphocyte, plasma cell, and macrophage. With time, Ashoff body assumes a granulomatous appearance with a central fibrinoid focus associated with a perimeter of lymphocyte, plasma cell, and macrophage. Eventually, Ashoff body replaced by nodule of scar tissue. This is the schematic representation of an Ashoff body. هذه كلها Ashoff body، وهذه histological picture under microscope post-mortem examination of the myocardium. فهذه احنا central focus of collagen fiber and fibrinoid necrosis. يكون necrosis باللي center surrounded by perimeter of lymphocyte, plasma cell, macrophage. then شنو ذني cells chronic inflammatory cells. chronic inflammatory cells. هذه الأشوف cell هي macrophage وهذه histological picture. الcentral هذا الcenter necrosis appear as an eosinophilic structureless materials in the center، وهذه هي surrounded by lymphocyte, plasma cell والماكروفاج. الليمفوسات هذه الصغيرة اللي تبين as dark dot، هذه الماكروفاج اللي هي كبيرة، السيل الكبيرة هي الماكروفاج. Antisco cells، اكو عندنا Antisco cells is an unusual cell within the Ashoff body. Those nuclei contain a central band of chromatin. These nuclei have an owl eye appearance and cross section, and they resemble a caterpillar when cut longitudinally. Antisco cells may become multinucleated, in which they are termed an Ashoff giant cell. هذه هي sometime we see Antisco cell اللي هي أصلها شنو هي which type of cell هي histiocyte شنو معناها macrophage بالبلاد من تصير بالتشو راح نسميها histiocyte. احنا قلنا ال component of Ashoff body اللي هي central collagen and fibrinoid necrosis surrounding اللي 3 cell type اللي هي chronic inflammatory cell اللي هي lymphocyte, plasma cell and histiocyte. sometime نسميها Ashoff cell. sometime هذه الهيستيوسايت راح تكون شوية شكلها غريب عن الهيستيوسايت العادية اللي نشوفها، انه هي راح تكون النيوكليوس عندها central band of chromatin. transverse cutting بالtransverse section من نسويها قطع cutting transversely راح تبين an owl eye تشبه الاول eye، ولكن باللونجيتودينال سكشن من القطع يكون لونجيتودينالي راح يشبه الكاتربيلر، لكن في اليرقة تشوفوها caterpillar so called Antisco cells. فاحنا which is Antisco cell is an unusual cell اصلها شنو histiocyte inside the Ashoff body. هاي الأشوف body وين تصير بالروماتيك characteristic of rheumatic carditis myocarditis. حكينا عن المايوكاردايتس، احنا عندنا قلنا involve pancarditis بالروماتيك fever all 3 layer، فاحنا pericarditis also inflammation of the pericardium, this irregular fibrin Irregular fibrins also present. These exudates resemble the shaggy surface of two slices of butter bread and have been pulled apart like sandwich يسموها bread and butter pericarditis. Ordinary does not lead to constrictive pericarditis. And the third layer also is an endocarditis. Left معناها شنو الاندوكاردياتس in endocardium والlining or the inner lining, innermost layer lining the heart, also the valve. Left-sided valve are most injured because they close under greater pressure than do right-sided valve. This led to the deposition of tiny nodule of fibrin which can be recognized grossly as verruca. تسمى verruca اللي هي عبارة عن شنو؟ عبارة عن clot راح deposition of a clot بالvalve تسمى verruca along the leaflet, so-called verrucous endocarditis of acute rheumatic fever. فverruca mean deposition of the clot when heart valve. Left-sided valve are most commonly injured in acute rheumatic fever. هنا as we mentioned in this schematic representation عرفنا الباثوجينيسيس اللي هو an autoimmune process. pathogenesis هو mechanism of action of this disease, how the disease occurred. قلنا الكوز هو an autoimmunity. الباثولوجي اللي هي شنو الفايندينج اللي راح نشوفها either grossly or microscopically. راح نشوف pancreatitis يعني all three layer اللي هي بالمايوكارديوم اللي also احنا المايوكارديوم عندنا والهارت فالف نفسها. راح يكون عندنا vegetation. قلنا الفيجيتيشن بالمحاضرة السابقة هي when there is a clotting deposition بالهارت فالف يسموها vegetation. وعندنا مايوكارديتس اللي characteristically اكو هذا البدي موجود اللي شرحناه هو called اشوف بدي characteristically occurred in the myocarditis of acute rheumatic fever. وعندنا البريكارديتس اسمها شرح البريكارديتس هو fibrinous pericarditis due to presence of fibrin in the pericardial space وقلنا like a sandwich. Grossly pathogen sequence and key morphological feature of this is the of acute rheumatic disease, heart disease. قلنا rheumatic heart disease is a systemic process, not also only involve the heart, but most common manifestation or involvement of the heart also affect the joint, arthritis of the large joint, also lung, chronic interstitial inflammation, also skin, subcutaneous nodule or erythema nodosum. Now, chronic rheumatic heart disease characterized by organization of the acute inflammation and subsequent scarring. Ash of body replaced by fibrous scar, so that these lesions are rarely seen in chronic rheumatic heart disease. Most characteristically, valve cast and leaflets become permanently thickened and retracted. فهذه الفرق بين الكرونيك هو مهمة عن الأكيوت هارت ديزيز. احنا بالكرونيك راح ما نشوف الأشوف بدي. ليش؟ replaced by scar, fibrous scar. There is an organization of the inflammation و fibrous scarring. Also بالvalve راح نشوف permanent thickening و retraction of the valve. وهذه الحالة احنا ما نشوفها بالacute rheumatic fever. The most important functional consequence of rheumatic heart disease is valvular stenosis and regurgitation. Stenosis tends to predominate. هنا قلنا valvular heart disease in general either stenosis or regurgitation. لا بالrheumatic heart disease بالchronic rheumatic heart disease commonly stenosis. Most common pathology in most common valvular heart disease هو valvular stenosis. هسه which valve involved؟ The mitral valve alone is involved in 70% of cases, with combined mitral and aortic disease in another 25%. The cusp valve usually is less frequently and less severely involved, while the pulmonary valve are most always escape the injury. Not involve the chronic rheumatic heart disease, doesn't involve the pulmonary valve. Most common valve affected is the mitral valve. Chronic rheumatic mitral valvulitis قلنا most common valve involved هو mitral, و most common pathology in valvular heart disease هو mitral stenosis. Valve leaflet and chorda tendina are thick, rigid and interadherent. Thickening اللي هي characteristic feature of the chronic rheumatic heart disease. Valve orifice narrowed to slit-like channel forming fish mouth deformity, like fish mouth grossly. Left atrial dilated and hypertrophic atrial fibrillation. ليش؟ لأن mitral valve من يكون stenosis راح يكون pressure overload بال left atrium causing dilatation to compensate the injury, to compensate the high pressure due to mitral stenosis, and become then hypertrophy اللي معناها المسل increase in the size of the muscle حتى تعوض البريشر الزايد عليها. then there is atrial fibrillation, ending in atrial fibrillation اللي هي arrhythmia, type of arrhythmia. Mural thrombi may be present, forming source for systemic emboli. Sometimes mural thrombi present in mural thrombi, any type of thrombus that present adhere to the heart chamber, or sometimes become a source for systemic embolization. In long-standing cases, left ventricle dilated and then become hypertrophied. This is the gross picture in acute rheumatic mitral valvitis superimposed on chronic rheumatic heart disease. It's a small vegetation اللي احنا قلنا هذه الفيجيتيشن شو نسميها بالروماتيك heart disease؟ نسميها verruca. هذه الفيجيتيشن موجودة على الهارت valve بالmitral valve along the line of occlusion. This is the rheumatic valvulitis. The mitral valve leaflets are thickened and focally calcified. This is the chronic disease, chronic rheumatic disease. There is a thickening هو characteristic pathology, permanent thickening, and then calcification, with a partial fusion of the commissure. Complication of the chronic rheumatic heart disease. Neural thrombi قلنا أن thrombi adhere to the heart valve, congestive heart failure, adhesive pericarditis, commonly followed fibrinous pericarditis. Infective endocarditis is infection of the cardiac valves or mural surface of the endocardium, characterized by vegetation forming adherent bulky mass of thrombotic debris. So from the name infective endo, it's an infection of the cardiac valve or the endocardium. Types of infective endocarditis: acute infective endocarditis or subacute infective endocarditis. Acute is a rapidly progressive caused by infection by high virulence microorganisms such as Staph aureus. The normal cardiac valve can be involved. It's associated with little host reaction. While subacute infective endocarditis is slowly progressive infection caused by low virulence microorganisms such as alpha hemolytic streptococci. It affects the normal cardiac valve, characterized by local inflammatory reaction and granulation tissue. فهذه إنه الacute was a rapidly progressive و high virulence microorganism, while subacute is caused by usually slowly progressive infection caused by low virulence microorganism. Pathogenesis. either local valve abnormality leading to the endothelial injury causing fibrin and platelet aggregation, forming source for microorganism. Local valve abnormality, injury, trauma causing the source for the microorganism and infection, or bacteremia from either intravenous drug abuser or infection elsewhere in the body or from the skin, from any source. Then there is a bacteremia causing the infective endocarditis. Predisposing factor, either cardiac abnormality, rheumatic heart disease. Patients with rheumatic heart disease are most susceptible to infective endocarditis. Mitral valve collapse, degenerative calcific aortic stenosis. هذه معناها cardiac abnormality. There is an abnormality primary cause. Valve replacement surgery, those with prosthetic valve, or intravenous drug abuser affecting a previously normal heart, even there is no primary abnormality بالheart or heart valve. Pathological feature, acute infective endocarditis, solitary bulky friable vegetations consisting of fibrin, platelet and microorganism. هنا بالانفكتيف اندوكاردايتس اكو فرق عن الروماتيك فيجيتيشن اللي يسموها فيروكا روماتيك فيجيتيشن. هي عادة بالانفكتيف اندوكاردايتس there is bulky the size more sizable, producing more sizable vegetation and more friable, يعني commonly more susceptible to be an embolism, to embolize elsewhere, consisting of fibrin, platelet, also microorganism. Then there is an infection for microorganism. Ring abscess with myocardial extension, sometimes they're producing a ring abscess in the valve ring. Neutrophilic inflammatory cell infiltrate, an acute inflammatory cell واللي هي component of acute inflammation والنيوتروفيل. فهنشوف neutrophilic inflammatory cell infiltrate. Sometimes systemic emboli to distal side to the brain, kidney, myocardium, and abscess formation at site of infection, also producing either systemic emboli or to distal sites or abscess at a site of infection. Subacute infective endocarditis, the vegetation اللي هي معناها الترومباي or clotting are firmer and less valve destruction. راح تكون قلنا بالacute هي friable softer than the subacute infective endocarditis. هنا لا بالعكس الترومبس تكون firmer and less valve destruction. Myocardial extension is less common, ring abscess is less common, where granulation tissue formation, where systemic emboli with less abscess formation. This is the important distinctive feature between acute and subacute infective endocarditis. 50% to 60% of cases of endocarditis occurring on damaged or deformed valve are caused by streptococcal viridae, a relatively panel group of normal oral flora normally present in the mouth. By contrast, the more virulent Staph aureus can attack deformed as well as healthy valve and is responsible for 10 to 20% of cases overall. It's also the major offender in infection occurring in intravenous drug abuser. So in intravenous drug abuser, the most commonly likely the pathogen هو Staph aureus. Also it can attack deformed as well as normal valve because of high virulency of this microorganism. While in the case of damaged or deformed valve, most likely microorganism هو الستريبتوكوكس فيريدان اللي هي normal flora oral flora. Aortic and mitral valve are the most common site of infection, although the tricuspid valve is a frequent target in the setting of intravenous drug abuse. Vegetation may be single or multiple and may involve more than one valve. They can sometimes erode, produce erosion, destruction of the valve itself. This is the gross picture in infective endocarditis. This is the endocarditis of the mitral valve. هاي نشوفها الفيجيتيشن التومباي كلوت الموجودة بالmitral valve. هنا acute endocarditis of congenitally bypass aortic valve with extensive cuspal destruction and ring abscess, producing a ring abscess in the ring of the valve and destruction. This is the histological appearance of vegetation of endocarditis with extensive acute inflammation. راح نشوف common or the most common cells present here neutrophil اللي هي acute inflammatory cells. هنا gross picture of healed infective endocarditis producing scar. هذه هو اللي يبين as a white color produce thickening and scar formation. Non-bacterial thrombotic endocarditis is a non-bacterial thrombotic endocarditis, also known as rheumatic endocarditis is another name, refers to the sterile vegetation on apparently normal cardiac valve. Sterile mean there is a non-infective من اسمها non-bacterial. It's a non-infective معناها الفيجيتيشن الكلوت or thrombi هي sterile ماكو microorganism و on apparently normal cardiac valve. Valve normal, not damaged, not prosthetic. Small masses of fibrin, platelet and red blood cell here component of the blood clot thrombus on endocardial surface. No bacteria seen, so it's a sterile. The name is sterile. Predisposing factor: malignancy, especially adenocarcinoma, hypercoagulative state, wasting disease, disabling patient called rheumatic endocarditis. Morphology: multiple small nodule along the line of closure. هذه النوديول هي شنو عبارة عن thrombus vegetation, usually small, less than 5 mm. Mitral is the most common affected valve. Microscopically fibrin deposition, platelet aggregation and RBC. Inflammation and fibrosis are absent or characteristically absent. ماكو inflammation, ماكو infection وماكو fibrosis. Spontaneous resolution can occur. This is the non-bacterial thrombotic endocarditis. Is a gross picture after postmortem dissection. Vegetation, هذه الvegetation red color, red mass along the line of a closure of the mitral valve. This is the second picture هي a microscopic picture of vegetation. هذه لونها dark red هذا vegetation وهذا هو الفالف. هذا اللايتر هذا الفالف. شوفون الvegetation not firm, it's a loosely attached. هذه شوية space بينها وبين الفالف. loosely attached to the heart valve. usually bland يعني شنو؟ ماكو inflammation, ماكو infection, no fibrosis. Liebman sac endocarditis occurred in patient with systemic lupus erythematosus. فهذه characteristic name إذا كانت endocarditis in patient has systemic lupus SLE. الاندوكاردايتس يسمى Liebman sac. الفيجيتيشن sterile هم ماكو infection. Most common affected valve are mitral and tricas valve. This lesion becomes uncommon with the use of the steroid for treatment of systemic lupus erythematosus. طبعا بالسابق كانت more common هذه الديزيز. هذا الديزيز more common لكن after introduction and the use of the steroid become less common. فهي type of non-bacterial endocarditis. الاسم فقط هو Liebman sac معناها تصير بال systemic lupus erythematosus. This is the gross picture postmortem examination of Liebman sac is the verrucous vegetation a row on the leaflet of the mitral valve. بالleaflet هذه small masses dark red mass هي clot or thrombus leaflets of the mitral valve. This is the schematic representation of all formation vegetation. هنا بالcase of rheumatic heart disease شوفون هذه vegetation هي small multiple small mass of vegetation along the line of the closure in one side. هذه الثانية البيكتشر الثانية IE معنى الانفكتيف اندوكاردايتس. نشوف الفرق هي bulky mass adherent mass تشوفوها و cause destruction valve destruction تشوفوها سوت valve هنا الvalve intact الماس small size multiple along the line of the closure بس هنا variable bulky mass and produce destruction. Non-bacterial thrombotic endocarditis راح تكون في medium sized اللي هي أقل من size of infective وأكثر من size of rheumatic heart valve medial size valve along the line of the closure و characteristically تكون bland ما بيها infection ما بيها organism مثل ما أخذنا definition of the non-bacterial thrombotic endocarditis. هذه type Liebman sac endocarditis اللي هي تكون بال systemically lupus erythematosus characterized by small to medium size inflammatory vegetation characteristically طبعا تشبه non-bacterial thrombotic endocarditis تكون bland ما بيها infection لكن الفرق انه on both sides of the leaflet يعني هذه الانتيريال وهذه الليفلت مرفوعة حتى تبين انه also بالposterior surface حسب ما هو مرسوم بهذا الرسم anterior and posterior in both characteristically occurred in both sides of the valve leaflets. Thank you for listening.